You've probably seen a dental filling. Maybe you even have one. It's one of the most common things in all of dentistry. But have you ever really stopped to think about what it is and what it's doing inside a tooth? Take a look at this image. This right here is a dental filling. At its core, a dental filling does exactly what the name implies. It literally fills a hole in a tooth that's been damaged by decay. The whole point is to restore the tooth's original shape and strength so it can do its job without causing any pain. Now, the one we're looking at in our picture is a specific type called an amalgam filling. You've almost certainly heard of this as a silver filling. It's this strong, really durable mix of metals that, believe it or not, has been a workhorse in dentistry for over 100 years. Okay, that brings up the next big question, right? Why would you even need one of these?
Well, the culprit is something called dental caries. We all know it by its more common name, a cavity. The best way to think about a cavity is like a tiny pothole forming on the surface of your tooth. And if you just leave that pothole alone, it's only going to get bigger and deeper, leading to way bigger issues.
So how do you fix that pothole? Step 1, the dentist has to remove all the decayed, damaged parts of the tooth. Step 2, they clean that area out. And then step 3, they place the filling material into that clean space and seal it all up. But you know that classic silver amalgam filling we've been looking at isn't the only game in town anymore. Today, dentists have another very popular option they can use. So let's compare the two big ones. On one side, you've got the amalgam, or silver filling. The pros, it's silver, durable, and it's usually the more affordable choice. On the other side, you have composite fillings. These are tooth-colored, so they blend right in. But they tend to be a bit more expensive and might wear down a little faster, especially in your back teeth. And that whole durability thing raises a really crucial point. Whether it's silver or tooth-colored, is a filling a permanent fix? I mean, how long can you really expect one to last? Let's go back to our original image because it's a great reminder that even a really strong, perfectly placed filling isn't invincible. I mean, think about it. Your mouth is a tough place to be. There's a ton of chewing pressure and constant temperature changes. So over the years, a filling can just plain wear down. It can crack or chip. Sometimes a little cavity can start to form right where the filling meets the tooth. And yes, sometimes they can just fall out. And that is exactly why regular dental checkups are so important. Your dentist is keeping an eye on your fillings to catch these little problems before they become big ones. So we've looked at all these details. What's the big picture here? What's the main thing you should take away from all this? Dental fillings are a really effective treatment. They are one of the most important tools a dentist has to stop decay cold and save teeth from much, much bigger problems down the line. At the end of the day, a filling has two critical jobs to do. The goal is to stop the decay in its tracks and restore the tooth's function and shape. It's about getting the tooth healthy again and then making sure it can work properly. And that just leaves us with one final thought to chew on. As dental science keeps pushing forward with new materials and better ways to prevent cavities in the first place, you have to wonder, are we heading towards a future where fillings just aren't necessary anymore? Something to think about. Thanks for tuning in.